Knee pain. Ugh. It's just one of those things, right? It can make a simple walk feel like a huge deal. And millions of people are dealing with this every single day. But what if? What if the answer wasn't some complicated new drug, but a super simple mineral we've known about forever? Let's dive in and find out.
So could it really be that simple? Could one little mineral be the key to easing one of the most common pains on the planet? That's the big question we're tackling today. We're going to follow the science, see if magnesium, applied right onto the skin, can actually make a difference for people with knee pain. And we're talking about a condition that affects a huge number of people. So let's get into it. Okay, first things first, let's get a handle on just how big this problem is. We're talking about knee osteoarthritis. It's a degenerative joint thing, and trust me, it is super common.
And when I say common, I mean really common. To put it in perspective, one recent study in India found that somewhere between 22 and 39% of people have it. Think about that. That is a massive number of people whose daily lives are just completely thrown off by this.
And listen, this isn't just a small annoyance. The study describes it as this persistent, dull ache that just flares up whenever you move. For so many people, that means dealing with constant discomfort, stiffness. It's a real hit to your mobility and quality of life. So you can see why finding some real relief is a huge deal.
All right, so let's shift gears and talk about our potential hero in this story, magnesium. People call it the unsung hero of our bodies, and for really good reason. I mean, this stuff is involved in pretty much everything. Just take a look at this list. It's a major player in over 300 different enzyme reactions. It's absolutely essential for making ATP, which is basically the energy that powers our cells. It helps regulate our muscles, our nerves, even how we handle stress. Bottom line, if you don't have enough magnesium, things can really start to go sideways.
Okay, this is where it gets really cool. The easiest way to think about it is like this. Calcium and magnesium are the yin and yang for your muscles. Calcium tells your muscle to contract, to tighten up. Then magnesium comes along and basically tells calcium, all right, your job is done, and lets the muscle relax. So when you get a muscle cramp, that's pretty much a muscle that's stuck in on mode and can't relax. And that's a huge light bulb moment, right? A lot of these muscle issues might just come down to this simple mineral imbalance.
So, you're probably thinking, okay, I need more magnesium. I'll just take a pill, right? Well, it's not always that easy. Turns out, the traditional pills can have some real drawbacks.
Here's the problem. For a lot of people, oral magnesium is just rough on the stomach. It can have, let's say, a laxative effect, long before your body gets a chance to absorb what it needs. In fact, one source points out that a really common form, magnesium oxide, might have an absorption rate as low as just 4%. That's not great.
Which brings us to a totally different way of doing things. Transdermal magnesium. Now, it's called magnesium oil, but heads up, it's not actually an oil. It's just a super concentrated mix of magnesium chloride and water that happens to feel oily. And this is the real game changer, because you're absorbing it through your skin. It completely bypasses the digestive system and gets right to where it needs to go, in your bloodstream and muscles, without any of that stomach drama. Okay, so this is the moment of truth. Does this whole through-the-skin approach actually work for knee pain? Well, a really interesting clinical study from 2024 decided to put it to the test.
The setup was pretty simple. They took 40 patients with knee osteoarthritis and split them into two groups. Everybody got the usual physical therapy, but Group A, the test group, also got Epsom salt soaks and had magnesium oil put right on their knees. Group B, the control group, just got the standard therapy. That's it.
And the results? Whoa. They were seriously striking. Just look at this. On the left is pain during activity, and on the right is overall function. And for both of these charts, a lower score is better. Now look at the green bars. That's the magnesium group. It's not even close. They had way less pain, and their knee function was dramatically better than the group that didn't get the magnesium. But get this, it wasn't just about feeling less pain. They also measured the strength of their quadriceps, the big muscles in the front of your thigh. And look at this chart. The magnesium group, Group A, had a huge jump in strength compared to Group B. This is so important. It's not just about feeling better, it's about actually getting stronger and having more support for that knee joint. I mean, the study's own conclusion really says it all. They found that adding magnesium made a significant difference in everything: pain, mobility, and strength. That's some pretty compelling evidence that this simple little mineral can be a seriously powerful tool.
Okay, so the science looks really promising, right?
But what does that actually mean for you in your day-to-day life? Let's talk about how you would actually use this stuff.
Honestly, it could not be simpler. You just spray it right on your skin, on a sore knee, for example, or even on bigger areas like your arms and legs. You rub it in, let it absorb for about 20 minutes or so, and then you can rinse it off if you want. And hey, if you feel a little bit of a tingle, don't worry, that's totally normal.
But wait, before you run out and grab the first bottle you see, you should know that not all magnesium oils are the same. Purity really, really matters. One of the sources we looked at actually highlighted a brand that uses something called USP Grade magnesium chloride. That's basically a pharmaceutical-grade standard for purity, so you know you're getting the good stuff.
That brand, by the way, is called 7 Minerals. It's a great example of what you should be looking for. It's got that USP grade purity we just talked about, it's made to be absorbed really well, and it doesn't have a bunch of extra junk in it. It's a perfect example of a product that lines up with the science we've been discussing.
And you know what's cool? The uses for this go way beyond just knees. You can use it for all kinds of things. Try spraying it on the bottom of your feet before bed to help with sleep. Or rub it on your temples if you have a headache. Got a muscle cramp? Put it right on there for quick relief. It's just a super versatile tool to have in your wellness toolkit.
And that really brings us to the big takeaway here. This whole story about magnesium oil and knee pain is such a great reminder that sometimes the best solutions don't have to be complicated or expensive. Which leaves us with a final question to think about. If a mineral this basic can help so much, what other simple, powerful health solutions are we overlooking every day?